Yes, Keval Shah. So, hello and welcome to Seven Sentinels. This is Grand Master Class, and I'm Peter Simon with you. Today we are conducting a speaking session, and this is Dr. Keval Shah from India. Yes, Keval, you can start now.
Good morning.
Good morning, Doctor.
I am Dr. Keval. Please be seated and make yourself comfortable.
Thank you very much, Doctor.
So, may I know what brings you in here today?
I cannot just tell like that, but there are some sort of ulcers, on my tongue. They started right last night. I have suffered from these on and off since I was a child, and there were several attacks in the recent months. Yeah, usually they clear up after a few days, but 6 months ago, I started working as a salesperson.
Okay.
So I had some problem from then.
I'm sorry to hear that you are experiencing all this. But before proceeding further, I would like to carry out an examination. Is that okay for you?
Yeah, of course, doctor.
Okay. So, after examining, I suspect that you are suffering from Aphthous ulcers. And but before that, I would like to ask you some questions to get a clear understanding the current problem that you are suffering. May I?
Yeah, of course, doctor.
Okay, so can you please let me know that have you ever had a history of diabetes or inflammatory bowel disease in the past?
Actually, um, yeah, I did not have any serious problems like that, really.
Okay, and in the past, did you suffer from any viral infection like herpes virus or anything like that? If you
No, doctor. I'm
remember,
not sure.
okay, that's good to know. So the this condition that you are suffering from is known as Aphthous ulcers, and what do you know about this condition? Can you tell me?
I don't know much about this. I only know that I am facing a lot of trouble and stress because of these things.
All right, as you are suffering from as you are suffering from this problem, and I can understand that the concerns are quite reasonable, but be rest assured, I am here to answer all your questions. So this condition has no known cause, as the current research in the medical literature suggests that these Aphthous ulcers are a reaction of our immune system, and this reaction in turn is are caused by a various are caused by various conditions like when a person is undergoing through stress, as you have told me about that. Also, if there is some hormonal imbalance or any viral infections in the past, or if an individual has encountered any allergic reaction. So these are all the possible reasons, and anyone can be one of them for your condition. Is that understandable?
Yeah, of course, doctor.
So according to my opinion, I would like to pencil you down some blood investigations to effectively manage your condition. Is that okay for you?
Yes, doctor, definitely.
It's good to know that you are agreeing with my recommendations. However,
Yeah.
in the meantime, we can discuss some management plan that you can that
One thing, doctor, I
yes.
want to ask you something. I want something which is, more effective than normal things.
All right, I can understand your concerns, and I am here to help you in every step of the way. So for that, we can discuss some management plan to effectively manage your symptoms.
Yeah, that would be fine, doctor.
Yes, as these Aphthous ulcers don't have any particular treatment as uh, as far as the research is concerned. So there are just some preventive measures that we can take uh, to provide you symptomatic relief. So shall I discuss them with you?
Yeah, of course, doctor.
Okay, firstly, you can use some warm water with salt in it to rinse your mouth so that it will provide you some relief. Also, I'm going to prescribe you some medicated mouthwash which you can use before bed and apply some antiseptic gel. However, and However, a paracetamol prescription will also be provided to you, and I would recommend you to drink plenty of fluids. Also, take care that you are avoiding any type of spicy and sour foods. Is that understandable?
Yeah, of course, doctor.
So as I recently told you that these ulcers do not have a specific treatment, and this management discussed above is pretty much enough to provide you symptomatic relief, and these ulcers will resolve by themselves in the course of next few days. Also, we can arrange a follow-up appointment after 2 weeks. But in the meantime, if you experience any worsening of the symptoms, you can definitely contact me anytime. I am here to help you any time of the day.
Yeah, thank you very much, doctor. But one last question.
Yes.
What are causing these ulcers to come again and again? I mean, how to stop them from recurring?
Well, the recurrence can be stopped once you can once you can manage your lifestyle effectively. For that, what you can do, as these ulcers do not have a specific cause, they are happening because of many things uh, and going inside our body. It can be stress, hormonal imbalance, some viral infections, or also some allergic episodes that our body might have encountered in the near past. So I would strongly advise you to take some healthy lifestyle measures like eating healthy food, doing some physical activity, uh, diverting your mind from the busy work schedule, and all those things will definitely help you in the long run to effectively manage these ulcers from recurring.
Yeah, thank you very much, doctor. You have given me a valuable information. Thank you once again.
Thank you. Take care. I hope that I have answered all your questions and addressed all your concerns.
Yes, right. Now, coming to the point, yeah, I have noted a couple of points. You you have improved a lot, definitely. I can see that difference, a drastic difference. Yeah, you came from nowhere, but you landed up somewhere, which I can say, yeah, it's not just above average, but better than that. So the confidence level has increased a lot. The fluency with which you're speaking is really appreciated. And then the way at using the vocabulary, exploring sentence structures, and the collocation, especially words with words, how they are matching, I can say you're doing a good job, definitely. But grammatically, yeah, there are a few mistakes here and there, off and on. You can definitely bother about those things, and you can definitely help them. You help yourself regarding this by taking the transcript. You can check yourself, and if you have any doubts regarding those sentences, if you're not quite confident, you just take them and modify and send them to me. I'll see whatever I can do. If you had sent something, okay, so we can discuss that one. That will be beneficial for everyone. And then yeah, I have noted down 2 points here. If, okay, is there any symptoms in the past? Is there any symptoms in the past? So here it's a singular plural mistake. First thing is are there should be there, not is there, because any symptoms you told. So it should be are there any symptoms. Number one. Number two, it should be past tense, not are there. It should be were there. Were there any symptoms in the past? Past, you are saying, not are there. It should be were there. Are there any symptoms now is okay, but past, you are already using the language, in the past. So it should be past tense, not present tense. Is there is wrong. In the first place, it's plural. So it should be are there at least. And if it is in the present tense, are there, but it should be in the past tense. It is not are there, it's were there any symptoms in the past. So rule number one, whenever there is a word which relates to the past tense, you have to use a past tense. No doubt regarding that. Then second one is ulcers. Ulcers will resolve by themselves. Ulcer will resolve by itself. It's not themselves, it is themselves, plural. Okay. Himself, herself, itself, but themselves, plural. Es, VES. Not self, it is selves. Okay, that's another mistake. So ulcers will resolve by themselves. Okay. So that is another mistake. Yeah, you are doing fine. Right. And right now that you are improving in quality. So two things you can do now. The mistakes are fewer than before. So now what you can try is try to gather some vocabulary and try to use substitute the already existing vocabulary in your mind with those vocabulary. So okay, let me examine you. Let me examine you. So now how to tell this one? Let me examine you. So how can we improvise this quality? Would you mind if I, okay, look at your ulcers? Would you mind if I would look at the ulcers? Would you mind? Is a special, is a request. Let me examine you. Would you mind if I examine you? Would you mind if I examine you physically? Okay. So that I can assess the exact condition that you are facing. Would you mind if I examine you physically or personally? Okay. So that I can evaluate the exact condition that you are facing. Okay. That would definitely help me to manage your problem effectively. So see how we expanded that into quality. So this is the way how you have to research. You have to find out. You write one sentence, improvise that sentence, add one or two, one before and one after. So let me examine you. As a doctor, physical examination will definitely help me to understand your exact situation. Therefore, this is my request. Would you mind examining? Would you mind me examining your ulcers in the first place? Then I can definitely evaluate the condition of your ulcers and properly manage your problem or effectively manage your condition. So that is how you can speak. That's the way how you can speak. So I hope you understand now. That is the next level, next step. Okay. And then ulcers will resolve by themselves. For this one, yeah, let us take this sentence. Ulcers will resolve by themselves. Yeah. Let me tell you the peculiar nature of ulcers. You know what? These ulcers have a special quality. You know, they resolve all by themselves. Okay. Nothing to worry about them. It has something called stipulated time. Once that is done, it's automatically resolved. The problem is automatically resolved. So extension, you can add extension and you can add quality to that. Were there any symptoms in the past? Were there any symptoms in the past? It's clearly evident that you have mouth ulcers now. What about your past? Did you have any time in your life experience? Did you, in any time of your life in the past, experience similar problem, maybe in your childhood or when you are in school or college? Do you remember? So just recall and let me know if you have faced these mouth ulcers in your childhood or in your youth. Something, some quality you can improve. That's what I'm telling you. So, is that clear, Mr. Keval Shah? Unmute.
Yes, sir.
Yes, fine. So,
Mm.
Keval, that's fine. Very good. So, I'm stopping the video. This is not just your speaking session, this is a lot of feedback. You can watch it. Okay, because my lecture is there, more important afterwards. Don't bother, nobody. So, for everyone, I'm telling you, don't bother about anything. Nobody knows who you are, nobody is bothered about you, nobody thinks about all these things. So, no need to worry. No need to worry. Okay, right. So, that's it. Next, next